Welcome to the Multicultural Media Online Conference, hosted by the Ministry of Health, Multicultural Health Communication Service, with the support of Multicultural New South Wales. I'm Jasusa Halaratna, Deputy Director of the Multicultural Health Communication Service, and we thank you for joining us today. And the Multicultural Media Conference is a platform brought to you to actually give you latest updates and prevention strategies and resources for culturally and linguistically diverse communities. And today and October is Breast Cancer Awareness Month, a time to highlight the impact of breast cancer in our community. Breast cancer is the most common cancer in women, and with females aged the biggest risk factors. And today we're so glad to have with us, joining us today, Professor Tracy O'Brien, New South Wales Chief Officer and Chief Executive Officer, Cancer Institute, New South Wales. Professor O'Brien was appointed as a New South Wales Chief Cancer Officer in July 2022. And with a career of over 25 years, we're pleased to announce that she has just received one of the most prestigious awards, the Order of Australia Medal.
Thank you.
Congratulations.
Very, very kind of you.
Thank you so much for joining us today.
My pleasure. It's wonderful to be here.
Yes. Thank you. And we also are delighted to have with us a good friend of Multicultural Health Communication Service and New South Wales Health, and she's Associate Professor Nirmala Padmanathan, and she's the Service Director of the Breast Screen New South Wales West Service, Sydney West Service, which is delivered by the Westmead Breast Cancer Institute, a comprehensive multidisciplinary breast cancer program covering Western Sydney. And she's also the anatomical, that's a hard word to say, pathologist specializing in breast diseases. Associate Professor Padmanathan, welcome to the program.
Thank you, Jessica, and thank you very much for inviting me.
Yes, thank you. And it's really important for us to touch base on what the latest information is about Breast Cancer Awareness Month. It's all about pink, but also the importance of how we are targeting culturally and linguistically diverse women in resources. So before we start, we'd like to acknowledge the traditional owners of the land from which we are all meeting from today. We pay respects to elders past, present, and emerging, and also pay respects to Aboriginal colleagues who may be joining us in this session today. We also pay respects to elders and multicultural leaders who are represented in this session. And before we start, we would like to share this video and that showcases what happens when you visit a breast cancer center or service. So let's watch this.
Have you ever wondered what happens at a breast screen appointment? Having a breast screen is the best way to find breast cancer early, and it could save your life. At the clinic, you'll be greeted by one of our friendly receptionists and asked to complete some forms. A female radiographer will take you into a private room for your breast screen. Make sure you wear a two-piece outfit, as you'll need to remove your top and bra. Next, the radiographer will gently position each breast on the X-ray machine. She will take scans of each breast in differing positions. To obtain a clear picture, the machine will press your breast firmly for around 10 seconds. You may feel some discomfort, but it won't last very long. Remember, you can ask the radiographer to stop the breast screen at any time. She will then give you privacy to put your clothes back on. You will receive your results in about 2 weeks. If nominated, your doctor will also be informed of your results. The whole appointment only takes 20 minutes of your time every 2 years. Book your free breast screen today. Call 13 20 50 or book online at breastscreen.newsouthwales.gov.au.
Thank you very much. And that is what exactly happens. It's 20 minutes. It's 20 minutes. I've done it, and it's really simple, but a lot of women fear it. Why is that? But how common, again, is breast cancer, and why is it important for women to go?
Look, breast cancer is the most common cancer for women. In New South Wales, 7,000 women will be diagnosed with breast cancer. To put that in some context, that's 125 women a week will hear those words, very, very scary, very confronting words that you've got. I've got breast cancer, and sadly 25 women will die. So it's an absolute priority to be on the front foot and be as proactive as we can, and to have conversations about breast health and breast cancer. If you have any symptoms, if you notice any changes in your breast, of course you should see your family doctor straight away. We're talking about breast screening today, which is really if you've got no symptoms at all. This is for healthy women. In terms of risk factors, as you said right at the start, Jess, age and being a woman are the biggest risk factors. 9 out of 10 women have no family history at all. So I think some people think, my mother didn't have breast cancer, or I didn't, my sister hasn't. You're not at risk. You're at risk if you're a woman and you're a certain age. So it is really important. It's a simple test. It takes 20 minutes. As that video showed, I think it's done in the most sensitive way, the most private way possible. All of the radiographers and the screeners and the staff are female staff. They're conscious of your privacy, very respectful of this. So it's a test that it hurts a bit. I've had it done as well. I'm a woman above 50. It hurts a bit, but it's 10 seconds of pain. And if you can have if you're unfortunate enough to have breast cancer, having it detected before you can even feel anything at its lowest stage, it's very, very curable breast cancer. So it's a test that could potentially save your life, no questions. 20 minutes of your time to save your life. I think that's a really worthwhile thing to be doing, to prioritise your health and put your health first and foremost.
First and foremost.
Yeah,
that's right. And Nirmala, I wanted to ask about the radiologists, because as you say, it is a very private session. You are met by another person, another female, to help you, and they're quite supportive.
Oh, they're extremely supportive. So these are the radiographers that are doing the actual the mammograms in the clinics. They're dedicated clinics for breast screening alone, and you have a lot of privacy. You have change rooms and subwait areas where you can wait. So it's extremely done in an extremely sensitive and private way, and they're highly qualified and trained radiographers who know how to do this in the most not just in terms of how uncomfortable it is. It's an uncomfortable procedure. You can't avoid that. But these women, they're all female radiographers, and they're very highly trained. They know exactly what they're doing, and they've been, doing this for many years. And we only employ those women that are, highly qualified and suitable to this task. So yeah, it's done in a very sensitive way.
And breast cancer for all women, but what are the rates for multicultural communities, Tracy?
In terms of the breast screening, we know that women from multicultural communities tend to engage with breast screening less than non-multicultural, non-core community women. It's around about 10% difference. So the first message is that all women, regardless of your background, should be making this a priority. About 50% of women are overdue for their breast screen. That's higher in multicultural women. That's about 60% are not up to date with their 2-yearly screen. So there is certainly a gap, and we really are working hard with all of the services, particularly those in areas where there are large multicultural communities. We're working hard with a number of grants to work with different groups within the communities and different cultural groups to really reach in and reach women in a way that's going to be as most impactful to try and really prioritise this and destigmatise a little bit this test as well, to make it something that is top of list. I think, for lots of different reasons, there can be language barriers, and we have lots of resources in different languages, but I think really women, regardless of your nationality or your cultural group, we're so busy taking care of everybody else. We have so many things on our lists to do. We're, taking care of children. We're doing things, and I'm the chief cancer officer, and I'm not too proud to say that I got behind in I'm a bit embarrassed to say that publicly, but it's the truth, because we're busy. So it's about making it a priority, and then it's about reaching in the right way, in the right language, and ensuring that people understand that this is done in a culturally sensitive way as well, so that we can help and support women from all backgrounds to get this test done. It's free. It's a free test.
And I agree with you, Tracy, when you're saying it's free. And And sometimes you do fall behind, but that's why these campaigns,
That's right.
these information sessions, the messages that we
That's right.
give are reminders.
That's right. Yeah, I think that having the conversation and not just the women that might be listening there, but men or who have sisters, passing that message on, sharing that message within your circle of girlfriends, reminding each other that, hey, have you had your screen? You can go together. There's opportunities to have group bookings, isn't there? And I'm like, yeah. So there's lots of opportunities there, and you do not need a doctor's referral. This is something that you can just ring up and make an appointment. There's a one. It's 13 20 30 is the number. If you 50, sorry, if you need to, it is. Thank you. Yeah, 13 20 50 is the breast screen number. 13 14 50 is the translation service. If you need that to help make the appointment, or you can jump online and book it online at breastscreen.nsw.gov.au. You can find a service located wherever you are as well, close to wherever you are. There's 53 different fixed sites, and
there's about 250.
And there's 200. There's 53 fixed sites, and then there's 15 mobile vans, and they travel around. And as Nirmala said, they cover 250 different areas across New South Wales. So no one should have to travel far to get to breast screen.
And you can always talk to someone. I think that's important. You can talk to a GP, you can talk to some services, and you can call, which is important. Now, Nirmala, in terms of working in Western Sydney, and you talked about, grants and how important that is to be able to tell people and women on how to do things and why people have done it, and also tell testimonial stories that it is easy.
Yes,
and you've done that in some projects that you've done in the past, but being in Westmead, how is that in terms of the rates?
Well, if you consider that about a third of New South Wales population is actually called, it's even higher in Westmead. And we have the lowest participation rates in New South Wales for screening, and it's even lower in the called population, so the linguistically diverse population. So it's an imperative. We really have to try and get through to these women. We really need to, at multiple touch points, whether you're a healthcare worker or if you're just a person in the community, if you know someone between the ages of 50 and 74, we really need to be promoting this message of breast cancer screening. It's incredibly important. You've just heard how common breast cancer is, 1 in 8 women. If you know 8 women, you can imagine that's a very common, isn't it? And in the called community, if we've got so many women that are not screened or under-screened, we really have to make it a priority to try and get this message across the community. And it's everybody's responsibility, not just the GPs or healthcare workers, but if you know somebody between the ages of 50 and 74, it's an imperative to get them to make sure that they have a mammogram every 2 years. It will save their lives. I see that firsthand working in a breast cancer clinic in Westmead, and you can see the women that have come through screening. You can pick up a cancer that's smaller than a grain of rice. These are ones that you cannot feel. You can only pick them up through this mammogram, and the mammograms are expertly read by 2 individual radiologists. So, it's a very high quality service, and it's free. We really have to make it a priority, because I've seen with my own eyes and seen every day in my work that breast cancer screening saves lives.
Now, you did say you can talk to anyone, and it takes a village. It takes a village where our families, our friends should be helping support each other. What are the other tips that you may have, both of you, in terms of trying to promote this and to face these challenges?
Well, from my perspective, I think women need to make this part of their routine health checks. And anyone who works in healthcare, all GPs especially, they need to remind women that they need to have a mammogram every 2 years. This needs to be just part of their routine healthcare checks that they do like you'd have a blood test for your cholesterol, for example. This needs to be part of those routine healthcare checks, I think. And we really just need to build that into our every year schedule. Yeah.
And Tracy, it's free.
It's free, yeah. Look, and I think that's an important thing for people. Australia's a lucky country. We have a great health service. But for many countries, and if there are new entrants into Australia, refugee backgrounds, they may not actually be aware that we have all of these services, and they're available for everybody. So the breast screen van travels to prisons as well.
Yes,
so we really do want to be inclusive. It's a free test. There aren't for cancer screening, there's breast cancer, bowel cancer, cervical cancer, and next year we'll have lung cancer. They're the cancers where we can pick up before there are symptoms and try and intervene and get the best results for people. Not all cancers we can do that for. Liver cancers and pancreatic cancers, there's lots of science going on to try and be able to diagnose those cancers. But for breast cancer, we can. And so I think for women who are at greatest risk, acknowledging there are about 50 men across New South Wales who also get breast cancer, but for women who have no symptoms, they can have this test done. It does literally take 20 minutes.
Absolutely.
It's easy to do, and it will save lives. It does save lives. The evidence is very clear there. We've heard hundreds of thousands of stories over the years where lives have been saved. And it's sort of kind of counterintuitive in some ways, because I think women, don't prioritise their health because they're so busy, because they want to be there for everybody else. Well, you've got to look after yourself, and your healthcare has to be first and foremost. You have to be alive, you have to be well, you have to be doing that. So by prioritising your own health, you're actually taking care of your family as well, and you can be there and do all of those things.
Yeah, and I agree, because you said that it should be part of your health checks, right?
Absolutely. I mean, we've got very good evidence to show that breast cancer screening does save lives. And it's not just about saving a life. It's also that if you pick up the breast cancers early, you need less invasive treatments. You're less likely to need a mastectomy where the whole breast is removed, or chemotherapy if the cancer is picked up early. You can get away with local therapy and endocrine therapy in many cases. And so I think women really need to make this a priority.
Yeah.
If you have any questions, please let us know. Go in the chat, because we have two experts here to answer all your questions about breast screening, and which is such an important topic. And it is Breast Cancer Awareness Month, and breast screening is one of the ways to find out about cancer, and preventative measures are available. Now, I wanted to ask, what are the things that you could do to lower risks of cancer?
Yeah, what a great question. There are some simple things, Jess, and it's so important, because cancer is the number one cause of people dying in our country from disease. And we know that risks of cancer are actually going up as we get older and we've got healthier populations. So prevention is incredibly important, and early detection. A third of all cancers can be prevented, and another third can be radically improve the outcomes by detecting them at their earlier stage. And there are some very simple things we can do. One of them is quitting smoking. And there's help available for that. It's not an easy thing to do, and I acknowledge that, but there's lots of help around that. It's about eating healthy food, lots of fruit and vegetables, maintaining a healthy weight. Exercise has been shown to be a really important thing in reduction of cancer risk, so that's another one. Having the regular screening tests, like we've talked about, making it a part of your routine to have a mammogram every 2 years. And then the other one that I think is really important is being health aware. So if you notice changes in your breasts, or if you have concerns, it might not be a lump, it might be a rash, it might be a funny feeling even, that's something that you should immediately seek help from. Yeah.
And it also...
There's one more too.
Yes,
I forgot to say that's important. Alcohol. Alcohol is an important one. There's no real safe amount of alcohol. Moderation always, Jess. Yes. Yeah.
I wanted to ask about how important it is in terms of age being a big factor.
Yeah. It definitely is. Age is a very important risk factor. It stands out. And when you're talking about population screening. You put a test in that is going to detect as many cancers as we can in the most efficient way. And so therefore a mammogram, which is the X-ray that's used, is most effective from the age of 50 to 74. And that's where we recommend people have regular screening. You're eligible, of course, you can get breast cancer at any age, and we realise that. You're eligible for breast screening from 40 and above, and you're still eligible to get a mammogram done after the age of 74. We do recommend that women talk to their local doctor about that if the test is right for them. And the reason for that is that the test is not quite as sensitive in the younger age group or the older age group. So it might overcall some breast cancers, or it might undercall it. It might not be the right test for the individuals, but it is available from 40 onwards, and it's free. The exception to that is for Aboriginal women. We recommend that Aboriginal women start their breast screening from the age of 40, and that's because there's clear data that they present earlier, and often with later stage disease. So it's a health measure that we've put in place to make that recommendation for Aboriginal women. Yeah.
And thank you for sharing that information. And I think that's key. A lot of people ask, why is it that I have to do it at a certain age? Because, and do I, some women probably past the age of 75 would think, why do I need to do that? So I think I just want to ask you
that question I do get asked that question all the time. We screen women between the ages of 50 to 74, as Tracy has said, that's actually the most common age when women can get breast cancer. And also mammogram is the perfect test for in terms of picking up early breast cancers in that age group. Younger than that, the mammogram might not be the best test, especially younger than 40 might not be the best test, and there may be other tests that they need to do. And older than that, we don't proactively invite these women to come to breast screening, but they can still book a breast screen between the ages of 40 onwards. Yeah.
So in terms of multicultural communities for Breast Cancer Awareness Month, that is an important message for you.
100%. Breast cancer does not discriminate. Breast cancer, some people think, oh, I'm from, my ethnicity. We don't get breast cancer in my country. That's not true. Breast cancer does not discriminate. If you're a woman, you're at risk. And that's why we have this screening test available every 2 years and make it free for everyone. We are a very lucky country. I really do believe that, but we've got to make use of those services. We're not using them adequately, especially in Western Sydney, where we have pretty poor screening rates. So it's a message I'm very passionate about getting out there.
Yeah, and then the data is not just for Western Sydney, across the board for women from multicultural backgrounds.
Yes,
it is lower than the general population. So there is a gap there, and there is a real need to get this message out to women from multicultural backgrounds. Yeah.
And it really is important because we have the multicultural media and the health workers listening on to how important this is. I'd also like to ask, and this is maybe a silly question, but if you had some issues, like for example, if you were not feeling well, and you had booked a mammogram, will that affect anything? What should you be doing?
It depends what you mean by unwell. Breast screening is, if you're talking about breast health, so if you feel a lump, breast screening is probably not the way to go. You're probably best off going to your GP and having them examine you and organize investigations. If you've got no symptoms in your breasts, breast screening is the place to go. If you're not feeling well on the day, is that what you meant?
Yeah,
you can always rebook. Okay. You can always rebook.
That's just one question.
You can book online. You can call 13 20 50 to book. So there's lots of ways of booking, and there's lots of cultural different language resources that are available. I think I've got like 29 or 20. A lot of language resources that are available on the website. So a lot of time has been invested in this, and I really hope people do use them.
Yeah. But there would be no problem to call and say, I'm sick today, not feeling well, and you would be rebooked. No penalty.
No penalty because it's free.
Because it's free.
But don't delay and don't leave it. Make sure you do it.
Yeah, and that's the thing. You may postpone it and then you don't do it again. So maybe some tips to to put some reminders.
That's right.
Put it in your phone, put it
Yeah.
in your diaries.
Yeah.
You know, you will get a reminder in the mail if you're between 50 and 74. So that reminder is there, but I don't know how many people look at their mail anymore.
Yeah, I mean, really, it's in the calendar on your phone assigned to it, and you can put an alert. Remind me tomorrow. That's what I've been doing. And I turned 51 this year, and I was excited when I was in my 49 when I want to do this, because I think it's important just so that it's peace of mind, isn't it?
Yeah,
It's a peace of
it
mind.
is peace of mind.
Yes.
Yeah. I think so, definitely. And you know, if it's going to save your life and it takes you 20 minutes and it's free, I think you'll kick yourself if you don't do it. So I do think it is peace of mind.
Yes. It is a very common disease, so we really ought to be, taking every measure we can to try and pick it up early when it's most treatable.
Now, a lot of targeted campaigns in terms of the grants that Cancer Institute New South Wales provides, which is fantastic, that it explains the myths, the misconceptions and misinformation, and that is important. So a lot of the community organizations reach out to you.
There've been over $500,000 worth of community grants in the last 18 months, 2 years, and we'll have some more as well coming up. And I think we learned a lot in COVID of how powerful the in-reach into community, hearing these messages from community leaders or respected figures within community groups and cultural groups is incredibly powerful. That message can cut through, more than my message as the Chief Cancer Officer. So working with all of these communities is really important, and we try and have a very broad brush and engage as many people. And I have to say, it's one of the parts of my job that I just love the most, because the communities are all so engaged and messages are all quite different, targeted to different communities, and that's really important, that we're sharing the right messages to the right people to motivate women to book in to have this screen, and then hopefully gather up their friends and sisters and bring them along as well.
Have to have an afternoon tea and then go, or go after.
Yes.
I think, Nirmala, when you were saying that some communities say, we don't have breast cancer, maybe it's just possibly that it's not shared, and a lot of people don't share those messages.
There's a lot of stigma associated with the word cancer. Sorry, Cass. There's a lot of stigma associated with that. And, I've done a lot of community events where women are just afraid to have it. They don't want to know. They're afraid of the impact that it'll have on them, and they think it's a death sentence just to see and hear the word cancer. But it's very treatable these days. It's incredibly treatable, especially when it's picked up early.
No, the stigmas, it's important we talk about stigma, and we do that, and it's been a big piece of work involving a lot of different organisations, Western Sydney Refugee Clinic, but we've done some work. And to Chellam, who's our multicultural advisor, a shout out, because she's led some of this work. It actually has been nominated for a Premier's Award, recognising how important it is to really have these important conversations. Early stage breast cancer, stage 1 breast cancer, 97% survival rate, with reasonably minimal treatment required. So I think people still do associate the word cancer with death, or somehow I've done something wrong and it's my fault that I've got cancer, and that's just not simply true at all. Cancer is something that just doesn't discriminate. It doesn't matter what background you're from. It doesn't matter what language you speak. It doesn't matter where you live. It doesn't matter how much money you earn. Everybody is vulnerable, and so there shouldn't be those sorts of misconceptions anymore in 2024. But I appreciate that there are, for all of the reasons that we're well aware of. But that's why these sorts of conversations are incredibly important. Yeah.
And the more we talk about it, the more we kind of normalize them.
I think there's a lot of lack of awareness as well, in especially in all the multicultural communities. We try as we might. We have to really work at a grassroots level and have these conversations in our communities with women that we know, and spread the message that how important it is.
And I think, Tracy, what you said about it's not your fault.
It's not your fault.
I think that's powerful message enough, doesn't it?
Yeah.
And that's kind of a very important message to say to communities and to
Yes.
women.
Absolutely. Just being a woman puts you at risk. It's,
That's right.
it's nothing to do with anything that you've done. All women are at risk. So
Yeah.
it's worthwhile getting the test.
With your conversations with women, it must be tough.
It is very tough. And look, there's a lot of stigma associated with it. And a lot of women, it's different from across every culture, but a lot of women are afraid to have a mammogram because they really don't want to know the result. So we really have to break down those barriers and make them understand that, picking up the breast cancer early will actually save their life. They'll have to have a lot less invasive procedures if they pick it up early. So to be proactive about it. And I do think that we've got a lot of work to do in that area. We're doing it. We are trying. We're working very hard. There's a lot of language resources on the Cancer of New South Wales Institute website. So we are doing everything we can, and there are a lot of community programs happening. And as Tracy has explained, all the grant programs that are available, we have to keep working in that space. Yeah,
There's no stopping.
No, there's no stopping.
No, there's no stopping.
Yeah, and Tracy, we've got the Multicultural Media Online here. And what message do you have for 2024? As you said, 2024, this should be something we should be really aware of. So how can we encourage more people, especially in Breast Cancer Awareness Month?
Well, look, it is Breast Cancer Awareness Month. So the first thing is let's have a conversation. Our second thing is that there are hundreds of thousands of multicultural women out there in the screening age between 40 to 74 who today are overdue for their breast screen, or they've never had one. So if there can be an action out of this meeting, it would be to encourage as many of those women to book in. There's very good data that if once you've done it once, actually, it's much easier to do the second time.
Yes.
So there's, first of all, getting those that have never been screened to get screened, and then those that are overdue for screening to book in and have their screening. Those that are coming up, be on the lookout, be booking that in and get that screening done. It's 20 minutes. It's free and it will save your life. It is really the best thing you can do for your health and ultimately the health that you can provide your family and the support that you can keep giving back to your family is keeping yourself healthy and well.
Yes. And as we said, you can bring a friend.
Yes, you can do a group booking. There's lots of ways. We try to make it as easy as possible. Many of our sites are open 7 days a week.
Yes.
So, we try to improve access and we try to bring the screening to you. So it's really up to us as everybody in the community to promote this message, take the story home. If you've got a person that between the ages of 50 and 75, encourage them to ask them, have you had a mammogram? If they haven't, you make sure that they do. It could save their lives.
It could save their lives. Professor Tracy O'Brien, Associate Professor Nirmala Padmanathan, thank you so much for joining us. And I think it's such an important message. It's free and it's not your fault if you get cancer, but it is important to book.
Yeah,
absolutely.
Yeah, thank you for the conversation.
Thank you.
Thank you. And thank you for joining us today for Breast Cancer Awareness Month, and also focusing on breast screening and how important it is to encourage conversations and to encourage women to go for testing. But one of the things that we wanted to recommend to go onto the website of Cancer Institute New South Wales and to check out the resources available in multiple languages. For now, please make sure that you encourage other women to get to book their mammogram and to have that conversation. I'm Jasusa Halaratna, Deputy Director of the Multicultural Health Communication Service. We had Professor Tracy O'Brien and Associate Professor Nirmala Padmanathan for this conversation. Thank you. Come join us again next time.